Well, hello, dear colleagues. How are you? I hope the Friday okay, and I hope in the world will be everything stable. Nowadays is unstable world, and I hope everything will be okay. And this is a case number 1 for today. Cerebellar AVM. Patient had bleeding from this AVM last year, and we already done 2 sessions of embolization, and today is session number 3. I asked my assistant and colleague Rowan Maratlo, ITLE, to do the 3D angiography from left vertebral artery, and you can see nicely there is a dural branch, posterior meningeal artery coming to the territory of dural fistula. No, brain AVM, yes, brain AVM. I'm so sorry. And it's supplying the AVM. And the second, it's a second branch. The main branch coming from the superior cerebellar artery on the left side. And there is a enlarged posterior inferior cerebellar artery on the right side, and now I asked Rawan to go to the right side, and we will do super selective angiography from the posterior inferior cerebellar artery on the right side. Okay, можно вот этот экран. My name is Mynzhylky Berdikhojayev. My assistant is Rowan Maratlo. Anesthesiologist Kalimosh Khalina, with the anesthesiology nurse, sizning atınız Gulnaz. Operating nurse is Madina, and video support as usual presented by Evgeny Grishayev, video and company. We are partners for nearly 10 years, and he's supporting us for all our live streamings. And this is a angiography from the right side. Yes, it looks like the pica is not involved, but to be sure, we will take a microcatheter and we'll check the pica territory. And there is also Bernasconi Casinari tentorial artery coming to the territory of AVM, and I think it's already connected to the posterior meningeal. We will check at the same projection thanks to liquid embolic cast, and on the left side ICA is clear, and yes, angiography from the left subclavian. You can see first of all the dural branch, and it looks like the Bernasconi and this dural artery are connected. After checking the right vertebral artery territory, we will go to the left vertebral, and we'll go with the several microcatheters. I think 2 sonic and 1 headway duo through the 7 French Fubuki will be okay. Okay, now we are ready. The guiding in the right vertebral artery. Headway дуо дайын ғой, да? Бүйте саш, мынаған тағы бір ой коннектор жалғай сал. Үшеу болады сонда. И так, Соник бар. Соник 1D235, да? Гибрид ішінен шықты ма?
Отдельно аштыңыз ба гибрид?
Гибриді ішінде шықты, да? 1D235. Окей. Держу. Ана Сониктің ішінен гибрид шықты ма? Онда оған отдельно 007 асықпай тұра тұрмыз, мен айтқан кезде ашыз. Okay, nowadays there is a little bit problem, and Sonic started to come only the microcatheter. I think something changed in the production, and yes, it was a notice from the Balt company, and nowadays we have Sonic only, and we need to order hybrid extra, but unfortunately we have limited number of hybrids. We have only one hybrid. Okay. 1D225 пока бер шарт қойсаңшы. Жоқ. 1D5 емес, 1D2 астындағысы, ең астында. Соның ішінен гибрид шығады. Пока тұра берсін. Ана гибридті хедвейді оның ішіне салып қойсаңшы. Бұрауын. Yes, and you can hear the Surah Bakara, and it's our regular practice. We put the Surah, and it's very helpful, and it's not annoying. It's a good. Так, наверное, пока. Бір секунд. Бичерите, жалғай жүрсін. Так, пока флаконда ауыстырмай тұра тұрық.
Пока бар.
Yes, we are not using the heparin. That's why the flashing should be all the time, and it's preventing from mistakes and complications. I took 3 Y connectors, one for headway duo and 2 for Sonics. Okay. Headway duo is ready. And today I slept till the 9:15 because of the 2 days, and I felt a little bit tired. 10 cases in today, and today we have another 5 cases, and all of them arteriovenous pathology. We have another one patient with the callosal AVM treated 2 times. 2 or 3 times we treated him. The first time was on the Neradict in September, then October, and then at the beginning of the year. The one session was with the Aptura, the first session, and Aptura completely resolved, and there is a small remaining part from the pericallosal artery. We will see. We had angiography, and we discussed with the family. We recommended 2 possible options. The option 1, to do gamma knife for the remaining part, but they already heard about the gamma knife and possible complications from the gamma. That's why they agreed to go for the treatment. Now they're doing final decision. And this case, and another 2 dural fistula, And one MCN reason for today. It's a menu for today. Yeah? Bugünkü menü. Okay. It's a menu for today. We'll see. The lateral tube is going. Kayda dursun. Okay. Round stays on the left side, but now we need to go to the right. First of all, I need to exclude the pica from the circulation. I don't need to pay attention for the pica during the embolization because the catheterization of the posterior meningeal will be a little bit complex. Then I want to place only one guiding, that's why we'll go. It's internal mammalian artery. Yes, it's a vertebral. Okay, we'll leave the guide wire inside, then we will go for the left side again. 3 microcatheters in left vertebral could be too much, but the option number 2, we can take the second guiding catheter. Huh? What do you think about to take second guiding? But for me, the one should be enough. It's like this. Stop. Назад. После. I need to go only to the first segment of pica. We need to go to the first segment of pica. And I think it's enough to do. It's a hybrid 8 and it's not so aggressive, that's why it's not so stable. But usually pica okay for the catheterization. Чекай, 8 аж пересоснешь? 8. Чекай 8. Okay, maybe it will go. Let's try to go with the hybrid. Аж перехвинс. Кырды. Okay. It's coming. It will take a little bit time, but no problem. There is a small branch in the first segment, non-visible small branch. Okay. Aşağı yürüsün. Чекай 8, аж пересос. It's too soft. And usually pica is going more directly. Okay, let's use the Chikai 8. Because we have a Sonic 1.2, which is 35. Шейкер денетр? Бәрі 12, да? Төртеуде? Все, отлично. Okay, біреуін Minix қойсаңыз. Yes, we have one Minix 18, and we have Squid 12. The rest is Squid 12. Squid 12 қанша?
Squid 12 үшеу.
Жоқ, в общем, шкафтың ішінде қанша 12 бар?
В общем, қанша бар Mynzhylky?
As the 4 pieces of Squid 12 is enough. Аж переслать шкафт. Okay, it's enough. It's very important to check the materials before the case started. It's my practice I learned from my residency during my full residency in military medical academy, and from the military teachers I learned that the material part should be enough before you will start any kind of intervention. It could be operation, it could be other type of interventions. To be sure that you are ready for any unexpected things. Okay, it's a different story, huh? It's more, it's a little bit stiffer than, it's a little bit stiffer than hybrid 8. And for the proximal navigation, maybe it's better to use a Chikai 8. Okay, can go a little bit distally. I think there is some small branch, that's why it's sticking at the orifice. Usually it's like this. Okay, now we can send. Okay, now it will go. And the headway duo has no angulation, that's why this small branch stacking could not go. Okay, let's observe. Yes, we have a flashing for the hybrid, for the headway duo. Okay, let's prepare the DMSO. DMSO жиналыш. Екі набор ашасыз. Екі набор керек. Екі DMSO жинап қойсын. This one and this one. I took a 3cc syringe, and also we have a 1cc. For the angiography through the headway duo, 3cc is enough. There is a supply. There is a supply. Stop. Вперед. Okay. Назад. Назад. There are two branches going from the pica territory. Вперед, вперед, вперед, вперед, вперед. And the vein starts in the middle. Okay. I think we need to take a second guiding catheter and to place in left vertebral and go to the dural branch. It's quite a big territory. Okay. Okay, let's take the second fubuki and place to the left side, and I will continue with headway dual, and we'll place the second sonic in the branch. Or okay, we can finish with the dural branch and then we can come back. No need to take a second. Connector жалғап қойсың. Ешіне нені жалайсаш?
Нені салсаңыз?
Чекайт саласың. Только салып қойсың. Так, жаңа соникті гибридмен ашып қойсаңыз. Окей. Родно посылсың. It's 1.225 with hybrid 7. It's remaining hybrids, hybrid with the Sonic, but the new Sonic is coming without the wire in the package, and we are not so happy. It was a concurrent superiority of the material. Apollo is coming without micro wire, that's why the Sonic was one of the best. It's still best, huh? For the navigation, for the distal positioning. Sonic is the better. Okay, 1.235 we will take for the dural one. Родно спокойно, да? Хорошо. I was surprised that in many centers, in many big centers in Kazakhstan, the colleagues could not do the same kind of treatment because of the restriction from the administrative part. It's really confusing, huh? It's really confusing. They have everything, but they could not do the best treatment for the patient. They could not provide the best treatment to the patients. And it's really surprising. Nowadays we are working in a limited condition because of the regulation from the insurance system and the Ministry of Healthcare. They decided to cut the financial part for the embolization of the patient, and we received nearly 60% from the amount we had last year. And now they put tips also, tickets for the cases, and I think it's not so good for the patient care. But nobody care. They are not physician, and they're just technical workers, and if they see the incorrect punctuation, they can put tips. It's very stupid situation. I think in different places, like Germany, Spain, it's a little bit different. Yes, first of all, I want to go to the posterior meningeal branch, and it will be more safer for the patient to start with. Okay, we will take out this and put it here. And I think it's better to place the sonic. It was some angulation. Let's see the orifice of the branch with cranial 30. Right 26. And cranial 37. Okay. We can use also the 3D roadmap, but I prefer to use a traditional 2D. It's more accurate. Назад, stop. Вперед. Stop. Also. Okay. Okay, maybe we can use also the 3D. 3D is like this. Then we need to replace it here. If you don't want to go there, it's already there. But if you want to go to the different places, yes. Okay, now we're inside. I think there is a small branch. Yes. Let's do it. I think it's a part where we're coming from extracranial to intracranial. Okay, let's send it distally. Okay, now it's proceeded. It's a beauty of using Sonic 1.2. And there is a bit of angulation. Okay. It's not so stable. It's not so stable. Okay. We need to change a little bit the strategy, but for this branch, no pesa.
Бұл чекай. Жылуды.
Сербич тук. Тоже. That's okay. Let's go with the. How do I do? Maybe we'll take a Traxxas. Traxxas is more stable, and for the dual navigation is better. Sen aldın birisi. Traxxas Racer. Madina Traxxas пересанша. Traxxas on tilt. Okay. So much material, but I think it's necessary. We need to change the flashing. It's another annoying part. We had a 1 liter saline from Almaty, but Chinese company with the saline, I think it's really killed the business. Хайсна гапти тур. Пропускайте тут. Traxxas, no? Yes, the Chinese company Kilun killed the saline production in Kazakhstan, and nowadays I think the most part of the saline presented in the hospitals are Chinese. And they're coming in plastic bottles. It's not the bags, it's the bottles. And the only size available. Ана физрастворды алып ауыстыра салыңыз ішіндегісін. Ja, основной. Мынау бітіп қалды. Дайын тұра берсін. Керек болып қалады. Yes, and the only volume, bigger volume is 500 cc. think it's about all Chinese products. Okay, from this point we need something J-curved. We will take a chicken. It артна несін кегіз қоясың. It's not bad that they producing this saline, but Kazakhstan has salt. We have a big sea named Aral. It's full of salt, and we could not produce the physiological saline. That is confusing. It's just water and salt. It's not the problem from the Chinese part, it's a problem from the Kazakhstan's system. Yes, the access is all the time like this. If you wanna put inside the box, it's all the time tries to go out. Okay, now we have a road map. And we can ship Sonic till this point. It's the idea behind the shipping technique. To go with the we can bend the wire around the micro catheter, the first placed micro catheter, and then we can push it distally. Okay, there is a branch coming. Okay, let's change the angulation. Start a second. I hope we didn't. Yes, there is a small branch. It's not a perforation, it's a small branch going extra the wall. Okay. Hybrid supplement. As the air conditioner is on 17, but It's quite hot in the operating room. Қалыс кетті ма? Ту, еп твою мать. Гибрид жеті ашып бере салшы. Так, бұның ішіне гибрид 8 кіруші еді. Пока жеті аша беріңіз. I couldn't control everything, that's why it happened. I have only 2 hands. Okay. Let's send the... Так, но не инерция. Сорт нажат. Гибридка. Хорошо. О, гибрид. Осы гибрид. It's not going. It's damaged. It's damaged. We gave a small J curve. Smart mask. Okay, for this reason maybe useful to take a 5 French distal access catheter and to work with the 5 French distal access to give a support to the system. As much as possible. Now we can send the sonic thanks to support of hybrid.
Один опять. Основной регион.
Okay, let's do the angel from here. Observe. So let's switch position and maybe it's possible to send it distally, yeah? Send it distally over. Yes, we tried Traxxas 7. It's more torqueable in distal territory. but hybrid 7 is also okay. Let's try to go distal. Okay, let's not go into the distal. Okay, maybe the previous position of the sonic was good. Let's not go. Okay. Okay, let's work from this position. It's all duro, and there is a washout from the superior branch. That's why it's worked like this. Okay, let's check it. Анан экинчи сониктин ичине салып коесуң. Жана гибрид. Экинчи сониктин ичине. Oh, there is a dual branches. Okay, we'll leave it here. Now we can go with the headway door up. We'll place the headway door up in the SCA territory. Okay, we need to flash it. The second sonic is 1.225. It's shorter tip. As the hybrid is nearly dead. Still possible to use. The only problem is it was a hybrid 7 only from the box. It was the last hybrid. Okay. It's a smart mask. And then then we may compare this part with this part. I think it's the same territory. Yeah? It's look like the same territory. It's too much friction. It's too much friction. It might damage the sonic. Жеті жоқ просто. Просто соник 1,5-25 ашып бере салсыншы. Екеуін бірге ашып беріңіз. A little bit problem to push the feed away. Okay, that's a big problem to push the feed away. Come on, water. Al. Еще так суспендимся сам. Пока вернем water. Okay, let's prepare the sonic. As I need to change my glasses. I couldn't see in close distance. Yes. Yes. We discussed yesterday about the protective glasses and the radiation-induced cataract, and today you can see Rowan is wearing glasses. Huh? It's very important. Yes, and glasses are reducing the possibility of cataract significantly. Yes, when you're young, it's very important to protect eyes. Yes, in the middle will be Sonic 1.5 25. It's a 7 French Fubuki through the short 7 French keys, and through the Fubuki 7F we can place 2 Sonic and 1 headway duo. It's very useful. Up and then going down, up and down. Пациент химлоотер. Дютилоотер. Дютилоотер. Okay. The general anesthesia. It's very important in this navigation. Yes, now we can control in both AP and lateral. Branch. This part is okay. Yes, it's close to the nidus. I need to check my guiding. I think the guiding is nice placed. Okay, now we'll take Traxxas to push the I don't think we need so much needles here. We'll take a Traxxas, we'll do a little bit more angulation on the Traxxas with this needle. Okay. Okay, J curve is better, and let's take this line. Yes, the problem is it's a Friday, it's a working day, and yesterday it was a Thursday, and also it was a working day. That's why not so many friends was on YouTube. And the beauty of weekend cases, the people looking YouTube is more on weekends. Okay, I couldn't push my headway to distal. Now it's a part of tip. Then we can pull the sonic little bit. Okay. Little bit back. Okay, now I think it's better. Then we can place a couple of microplex coils. And then, no, it's okay. Now it's better. Even the headway, so soft microcatheter, we couldn't push through all this tortuosity. Madina, spiralдар көрсетшеңші. Бір жарым төрт микроплекс, екі спираль ашып бересіңіз. И ана отделалканы дайындай саласыз. Okay. We asked for Hyperform 3D, Hypersoft 3D, yes. 1.5 bar, 1.5 by 4. It's the best coil. We have another best coil is Optima, and also Valabi is the best coil. Penumbra coils is best. But on the shelf, the softest coil is Optima, and the Microplex is the softest coils on the shelf. The Optima is 1.5 by 3, that's why we asked for 1.5 by 4. 1 centimeter longer. Yes, and the Ministry of Healthcare with the insurance system initiated the calculation of the price for the material, and they took as a reference the small centers with the limited number of cases, and also the centers with the less experience. That's why I have some thoughts about it. Next year it might be a problem with treatment of this group of patients. The coverage of the AVM and aneurysm could be decreased, and it's not so good tendency. We're showing the as much as possible treatment strategy, but in many places the colleagues with limited experience, with the limited access for the material, also can do the treatment of this group of the patients, and finally it's not so good for the healthcare system. And the insurance system tries to limit the financial part, and okay, the healthcare and saving money, it's it's not the same things, huh? Okay. We may place one more coil, or we can wait a little bit and it will thrombose. Күтетіреміз ба? Или тағы біреуін тығып жібереміз? Okay. Rowan is neurosurgeon. He said, okay, let's place one more. Okay, optimal 1.5 by 3. Поджармش. Helical береміз. Helical super soft 1.5 by 3. It's another best coil in the world. Yes, the whole material presented in our cat lab in Angio Suite is the best in the world. I need to flush with saline. Then we'll keep the headway duo in SCA. During the retrieval of sonic, it will be helpful. It's very helpful to place the second microcatheter in place. Time to time we are placing also the wire inside, and it's very important. It's very helpful. It's the things we learned from the conferences, from our colleagues. Optimal. Sure. Okay, I will bring my microcatheter a little bit back. Okay, this position. Okay. Sure. Okay, I will place a 3cc syringe for the headway duo. Let's do Andrew from the isolated headway duo. It's nice, huh? It's so-called pressure cooker technique. Yes, we don't need to do so much reflex. I think we can start with the dural branch. As we see the markers, we don't need to go proximal, and now we will exit from the 3D roadmap. We'll put the histogram and we'll replace. Now I need mostly the territory. We'll start from here. It's very important. These branches are going to the brainstem, and we don't need to go there. We need to stop at this point. It's a 35, that's why it should be okay. And there is some dural supply, but it's not a problem. No? We can exclude all this region. Okay, let's start with the dural part, and then we can go to the peel part. Okay. Так, Sonic, squid unicolor. Наркоз поглубже, дексаметазон 12. Тиринг наркоз, дексаметазон уника. It's at 12. It's a midday. Oh, there's. Видишь, екінші шприцқа тоже жинай бер. Струйный жасайсаңыз. Ага. Так, екіншісі ғой бұл, да? Екіншісін жинай сал. Ага, все, жиналды ғой. Ага. We'll change for the glue mode and a little bit increase the radiation. Миллилитр 4 миллиграмма, 3 флакона, 3 ампулы. It's going to the meningeal territory. That's why it's important to check the AP. And the reflux is not so well visible. Reflux жүріп жатыр, но особо көрінбейді. Көріп тұрсың ба, reflux? Yes, the reflux is coming, but so badly visible. Okay. We have time. We don't rush. We have time. And now we isolated the AVM. Let's check it. Sure. Yes, it could be better to place the second microcatheter. The microcatheter number 4 in the pica, but okay. Well, we have time. We can analyze the angio. We can place it here, and then we'll go for the first selective images. Let's compare it. It's a different territory. Huh? It's look like different territory. It's more medial, it's more lateral. There are some reflex, and I think we reached the marker. Yes, the both markers are reached. Let's wait. Yes, the both markers are inside the liquid embolic. Женя. Можно подключать. Okay. We're waiting. We decided to shake the squid and it's not so visible. It's a teamwork and yes. I'm waiting for the new portion of the squid. It's better, I think. Yes. Hold Jujers. Yes, it looks like it's reflexing, but it's very hardly visible how much there is a reflex. Yes, not so much. Let's put the timer. Yes, it looks like we are at the second marker. Та бревна отпирысаш? Yes, it's the nice example of creating the thrombosis with the coil. Так, набор шприца шприца стал, да? Let's start with the second microcatheter to keep the time. Keeping attention on the reflux. Yes. It's going forward. Okay, let's wait with this. Toch squidje не видно. Yes, and we need to keep in mind there is a arterial connection. Veriyor. Takip alıyor. And now we connected with the territory. We came from the cerebellar artery, and there is a reflux, and I didn't see it. That's why I need a assistant. There's so many details we should control. Yes, it's mostly the AVM. Okay. Now we're going to the territory with this first sonic. Tercih ediyor. Going to the territory with the AVM. Okay. Rodno is so-called eagle grip technique, thanks to Fabian. Rodno. Fabian called it Kazakh eagle grip technique. Неге қарап тұршы, бірінші жоғарғы микрокатетердің территориясына. And also the reflux. I have a reflux. There is a branch in parallel. There is a branch in parallel. Okay. It was a connection between two branches. We're still in the arterial territory and not touching the venous part. Taxis Peresar. I have an idea. I hope you can understand what I wanna do. We need the eye on the right pica territory. Последний ангел Mynzhylky. Последний. There's enough AVM, no? Okay, I think it's okay position. Yeah, Ronald? Reflex харап тұр. Now we're filling the meningeal collaterals and also the reflex. Huh? Okay, let's leave it here. We don't need to create so much reflux. I think it's enough. Now we have reflux on the upper microcatheter and we have time to wait. Okay. Okay, we can navigate it to the pica territory. Navigate to us, sir. И последняя ангиона смарт маск пройшла. Рыжик, надо. Yes, this isn't Texas. It's falling to the bezel. Yes, the first time it was also stacking here. It's in the bezel. Okay. Okay, as much as possible. Now we are controlling and geographically all territory. There is no venous delay. And then I think it's possible to leave this part of the AVM for the next session. Eh? Ron, what do you think? Yeah, we can leave this part for the next session. Eh? Do you agree with me? Келесіге қалдырамыз ғой, если что. Сол дұрыс болады. Okay, now there is a little bit reflux. It's look like. It's badly visible, but I think it's reflux. And also reflux here. We need to stop. Okay, I think it's a quite safe situation to finish this session. And the right pica territory we can leave for the next time. And it shouldn't be any problem. Okay, let's try to inject a little bit more, and if it's not possible, then we have a possibility to finish at this point. The reflux is as much as possible. Yes, on the posterior meningeal there is a reflux, but it's not so much. I think till the marker, and it's not bad. The first principle of medicine is noli nocere, yes? Not make a condition of the patient worse than it was before. As it's connecting to the dural branch. And it's very important to disconnect all this territory from the dural supply. It's very important. Okay. On AP we can control the distal dural penetration. On lateral we can control the reflex. Okay, let's leave the dural branch and work with the superior cerebellar. There is a reflex. Huh? We are working more than 20 minutes now. Okay, let's wait. At the end we will check the ICA on the right vertebral before the finish, and it's a long day, and I hope if this territory will be safe, we can call this patient in a couple of months for the next session. Let's call it next session, it's not the last session, but I hope it will be the last session. Okay, let's wait a little bit. And then we can take the meso. Before the retrieval of both microcatheters, we can inject a little bit of the meso. It's Shimon Maimon's technique. We learned long time ago, and also René Chapeau is using this technique. He's injecting very fast the meso to push the liquid embolic for the new territories. But we will do it in a Maimon's manner, slowly, and Alberto Gil's manner, in a tac-tac manner. There is another connection with the dural territory. Now the reflux is as much as possible. Кастотр. И не снат на фьюжерсаш. We'll take first the meso for the dural branch. We will inject a little bit. Take more the meso, okay? I think from the dural dural territory we did as much as possible. And now we'll continue from the cerebellar territory. We are at the marker number 3. It's maximum reflux. Let's wait a little bit and then we can inject from the dural and we can take out the dural microcatheter. It's a continuous injection. And there is a reflux. Okay. Because of the friction inside the guiding, I don't feel how much I put the pressure. Can take this then so. İğnesini töмен қаратып қойсаң, сол кезде тантал төмен шығып кетті. Yes, the dural territory is clear and it's good. I'll put the flashing a little bit harder. Okay, now we have only 2 microcatheters. It's better. It's possible to control better. It might be rupture. It might be rupture. It looks like rupture. It's extravascular. I think it's outside the artery. Okay. The segment is already closed. Yes, there is no delay in the arteriovenous phase, and this part of the AVM is as much as possible secured. We will replace the microcatheter to the territory of SCA. Ладно, как-то классно, стол, просто стол хэттер пока. Okay, it's quite safe. Yes, we took a Traxxas. Yes, there is option number 3. Number 2, I'm not sure the gamma knife is a good option in this type of AVM. It's a posterior circulation and okay. Now we are in the territory and tip of the microcatheter is as much as safe. Okay, we can leave it like this. Now we can retrieve the sonic. As with the 2 microcatheters, I can feel the pressure on the sonic. Yes. No, қайтадан қиып алсын. Қолым не болып қалмасын. Okay. That's the control. As I a little bit compressed the system, it's better to take like this. It's so-called endovascular hijama. Okay, let's do microcatheter injection. Oh, that's okay. It's weak. Okay, let's place some AP on the lateral. Okay, let's check with the micro. I will take back the, what do we do at this point? Okay, there is no supply for the AVM. Yes, no supply to the AVM territory. It's a regular territory. And now I will take the sonic out, headway out. I will connect aspiration to bring the catheter back. Take them also. Also. It's prevention of possible complication. It's a regular thing to have some dot of microemboli in the territory. That's why we did it. That's okay. The blood pressure is 105. Now I will take this here. It's like angel from the common carotid to check the territory. Yes, the territory is clear. Okay. Okay. Now 35 отбери, слышишь? 35 проводник. Проводник 35. Okay, we need the diagnostic wire. The grading is going to the subclavian all the time, but with the Fubuki it's possible to go without wire. Not all the time. Huh? Okay. Let's check the Bernasconi Casinari on this side. Yes, it stopped. There is no more Bernasconi. Yeah? Okay, let's put it up. And for the comparing, I want to show you. You see, there is a dural branch Bernasconi here, and there is no branch there. Okay. It's very important to check the territory. There is a meaning. The dural territory is cleaned, and for the next time we may focus only on the pica. It will be quite safe, and we did the control with the headweight duo in the territory, but let's do it with the microcatheter. No venous delay was from the microcatheter, but from the guiding the picture is the same. I will take out my guiding, and now I will ask Rawan to do control CT. There is a need for one more embolization session, and then I think there is two branches going to the AVM, and with two sonic we may complete the treatment without microsurgery. Okay, let's see. And nowadays the risk of microsurgery is increased because of the infectious complications. Selam astırma. We have a Darira from Ural city. Yes, she came with a touristic reason, huh? Yes, you can hear her voice. She's our fellow on the last course of a residency program, and now she's a businesswoman and has a private practice in Ural city. Okay, let's see. Okay, I think the city is ready. No, is not yet ready. Ашық тұр өсін. Ашық тұр өсін, қазір шықпайды. Ол шықпайды екен. Окей. Кеттен. Yes, city is nicht machen. Now Rawan should do it from the Andrew suite, and we called the Philips engineers to fix this problem. The button from the operating room is not working anymore. It's working, but time to time. That's a big problem, huh? Къде може да стане? Рован, къде на букли екран шарасаш? Рован, къде на... Букли екран шарасал. Okay, CT is ready. It's a protocol for all intracranial interventions and for the severe stenosis in the ICA and vertebral. There is a rule. We finish all cases with the control CT to early control of the complications. And now you can see the lateral ventricle is symmetrical, the third ventricle is okay, and a cast of liquid embolic here. We may play with this, and may play with this. Okay. I hope everything is okay, and we can finish the case. And next case, callosal AVM. The remaining part with 2 feeders from the ACA under general anesthesia. We will start in 30 minutes. Thank you for watching. See you in 30 minutes.